Welcome back to Desk Careers, everybody. I'm so excited to have another amazing guest with us here this morning. Today we are going to be speaking to Dr. Salman Waqar, who is the consultant ophthalmic surgeon who is an eye specialist at Moorfields Eye Hospital here in Dubai. Welcome, Dr. Salman. How are you today?
Very well, thank you. Thank you, Maria, for inviting me and for the opportunity to speak to you all today.
It's so exciting. I know we've met quite a few of your colleagues and learned about the different job roles that they hold, but I have to say yours is a really interesting one. It was quite a mouthful to remember and to pronounce. Talk to us about what an ophthalmic surgeon does and what on earth made you want to go down that career path?
Absolutely. So an ophthalmic surgeon is a fancy term simply for an eye specialist. We're also known as ophthalmologists, which again is a bit of a mouthful to pronounce, but it means the same thing. And this is different to opticians or optometrists, who are our very sort of valued work colleagues, but their remit is more about checking vision, prescribing glasses, whereas we're fully qualified doctors who then further specialize in the diagnosis and treatment of eye conditions and also performing surgeries for eye conditions as well.
So being an ophthalmic surgeon and the career path that you've chosen, what would you say have been some of the highlights that you've faced so far in your career?
Well, I think the biggest highlight in my line of work, certainly for me, is always the people that I get to meet every day and I'm able to help. Vision is so important for all of us, and any sort of change in our vision or loss of vision can have really quite huge impacts on our quality of life and also on our families and the people around us as well. So to be able to help someone with that and to help them restore their vision is a daily highlight, in fact. Other highlights have been, I've been very fortunate. I've had the chance to work with great colleagues. I've had the chance to work on innovation, surgical instruments, developing new techniques, and also sort of dabbling in and authoring a few textbooks as well. So it's been a very well-rounded career so far. And I think there's lots of highlights I can reflect back fondly on.
Can you remember being a medical student? Can you remember what that experience was like for you?
Of course, absolutely. It wasn't too long ago. And certainly being a medical student is a very exciting stage of any doctor's life. There's a huge learning curve, of course, because everything is new. You come out of your A levels or your undergraduate studies, and you're suddenly in that medical school environment where there's so much new things to learn. So you have to work hard. But I was very fortunate to have great teachers, a great medical school that I went to, and overall, I look back very fondly on that whole experience. But also, it sets you up for the rest of your career as well.
How would you say it would set you up? Like what would you say, other than the academics, what else does it set you up for?
Well, I think in that respect, it really depends on your institution. Some places are more academic than others. Others may have a more well-rounded, holistic approach. But increasingly, the traditional medical school model used to be just about studying the medicine, which is very important, and having that solid knowledge as a foundation is very important for your career afterwards. But I think more and more medical schools are becoming more holistically oriented, so extracurricular activities as well. And certainly one of the things that I enjoyed the most was just the sort of extracurricular environment we had. We had kind of drama societies, sports clubs, and various other things. And I made great friends, people that I've kept in touch with throughout my career. They're all in different specialties of medicine, but we keep in touch. And we run into each other, and we sometimes have to share more professional opinions and expertise as well.
It's really interesting. And when you were remembering those academic interests that you had as a young teenager, the obvious ones being biology and science in particular, and physics, you also mentioned English literature. And I'm really interested to learn a little bit more. And I'll tell you why. Most of our young students thinking about medicine, wanting to be aspiring medics, they don't look at the non-science and math subjects as subjects of interest that they could pursue. Would you say that English literature helped you on that journey, or was it something that you just did because of the pleasure of learning?
So I would approach that in two ways. One is just simply the pleasure of learning, which I think is very important at any stage in our lives, to have a passion for something And to be able to pursue that is almost a privilege. Not everybody around the world has that. But also, I would say that being a doctor, as is the case with many other professions, the more holistic and well-rounded you are as a person, the better you are able to excel in your profession, but also to be able to help others. So as a doctor, to be able to understand other people's problems, to understand where they're coming from and how best we can help them, can only really be achieved if we have a good understanding of the world around us in a more holistic fashion. So studying subjects outside of medicine helps create that. Also having experiences such as traveling and meeting people from different backgrounds outside of our immediate circles helps with that as well. And I think that apart from the professional learning of medicine, these things have really helped me a lot in my career. And the more experience I get, the more I realize that those things are vitally important.
Talk a little bit about your patient experience. Aspiring medics, again, they're really academic and they're focused on those academic subjects for obvious reasons. But what's it like to have a patient in front of you, remembering why you went into the field, remembering why you want to help those patients? But what are some of your experiences that you would pass on to a young medic and say, you know what, this is not something they taught me in the classroom, but definitely something I would encourage you to learn more about?
Well, that's a really good question, Maria. So certainly there are things that schools can teach us. There are things that our universities can teach us. And then there are things that just life in general teaches us just through experience. So similarly in medicine, for example, if we just look at the academics, you have things, for example, diseases and conditions that you would read about in the books. But of course, we are all different in varied kinds of ways. So from time to time, we'll come across patients who may have a condition, for example, but it may not present in the way that the textbook had taught us. And that is something that we learn with experience. Now, it's very difficult for a med student to learn that, but certainly just keeping an open mind and keeping a broader perspective on things is quite important. Separate to that, I think, is the psychological side of medicine as well. So a patient who comes to our clinics is not just a disease condition. They are a person. They have a family. They have employment circumstances. They have a whole variety of social issues around them that feed into how that disease might be affecting them. And that, again, is something that comes from just having an experience of interacting with people and getting to just understand better how the world around us works. So in that respect, just being academically inclined, but not getting these variety of experiences of life in general, may just hold you back a bit at the beginning unless you get those experiences in place. So I would strongly recommend just having a broader view outside of the academics of medicine to be able to develop into a well-rounded physician.
Thank you so much. Okay, let's walk in your shadow for a day. Take us through the first thing that awaits you to the last thing that you shut down before you go home. What's it like to be you?
Well, I think to be me in particular might be very complicated, but I'll talk you through it nonetheless. I think we're all complex in different ways. Certainly, I mean, I do enjoy my profession, and so I really do look forward to turning up to work every day. Usually in ophthalmology, we have a lot of clinics. We have some laser clinics. We have some surgical theater sessions. So a usual week would be a mix of all of these things, which is actually the wonderful thing about ophthalmology in particular, but also the rest of medicine as well, that no 2 days are much the same. And we get to meet a lot of different people. So normally I'd start off with the clinic. I might have to do a few laser sessions. I might have to perform a few surgeries. And later on, at the end of the day, I do feel that a healthy body has a healthy mind. And with the stresses of life in general, and in any other profession, but particularly in medicine, when we're dealing with so many different people every day, and they may have conditions that may be difficult to treat, it's really important to unwind. So I'd usually hit the gym, go for a run, get on the bike towards the end of the day, and then kind of just tie it all off with some time with family, and then restart the next day again.
Amazing, amazing. Okay, one more question, taking you back. The interview you would have had to go to university when you applied to be a doctor. What do you remember, and what can you offer as advice to any aspiring medic who's about to sit that medical interview?
Absolutely. So certainly the medical school interview is always a little bit nerve-wracking because it's something you've worked hard towards. You really want to get that position, and you may not necessarily know entirely what to expect in the interview. But most interviews have standard formats. I think the most important thing I remember really was that I was anxious, but once the interview got started, I eased into it. And it's really important to be yourself. I think that there are two ways to approach it. One is you may want to go for a particular institute, um, but also you want the institute to value you for who you are as well. And I think that's one of the tricky things that I've learned as I've progressed in life is that you may wish to be a part of something, but also that something may also want you to be a part of it as well. And that comes from honesty. So it's really important to be yourself, not to try and manufacture answers in interviews, but to say honestly what you feel is true. Of course, we all need a little bit of coaching with interviews and a little bit of polishing up of our answers, but broadly speaking, our answers should reflect who we are and what we aim to aspire to and what we hope to achieve from that institution. And I think that would keep us in good stead. So that's the most important thing I remember from interviews, and I try to apply to all interviews, including this one.
Amazing. I hope this is not bringing you back to those anxious few moments. You're doing amazing.
No,
Okay, your
I'm
top
not
three,
sweating just yet.
your top three career tips. You said find your passion and go with what you're passionate about. Medicine career really requires you to work academically, and it's challenging, but remember to find that healthy balance with life and work. And you mentioned to maximize on every learning opportunity. What else do you want to add to that?
I think that's a very comprehensive overview of what I've learned so far. I think what I would add to it, of course, is that, again, this is not specific to medicine, but I suspect it's more relevant to medicine than other professions in that the learning really never stops. So if you're considering a career in medicine, you must remember that you're committing to a lifelong career of learning. Technology, treatment options change every year, which is great for our patients because there's always something new and better coming out, but we have to keep up to date with it. So there's a lot of constant learning. It's not just that you finish medical school or you finish your postgraduate qualifications and that's it. The learning has stopped. You just have to keep updating, keep learning throughout your life. But at the same time, that's not really a chore. It's something exciting. If you're passionate about the career, then you enjoy learning all these new things, staying up to date, staying at the forefront. So to add to all of that, I would say keep inquisitive and keep learning.
And you've had a lot of opportunities to see cultural diversity in the experiences that you've had between working in Pakistan, in the UK, and now in the UAE. How has that shaped the doctor that you are today?
Well, I think it's had a huge impact on who I am as a professional today, mainly because healthcare systems are very varied across the world. So in Pakistan, I've seen a different kind of healthcare provision. In the UK, where I worked for the last 15 years, I've seen a very different kind of healthcare system. And the UAE healthcare system, again, is quite different as well. The patients, how we treat them, how we help them remains the same, but the system around it can vary. And also meeting people from different cultures also feeds into that learning process tremendously as well. So it's certainly an experience that I would strongly recommend to any aspiring medic. Now, I know that it's not always possible to achieve because different places have different licensing regulations and requirements, and there may be family reasons why you may not be able to move around as much as well. But certainly it's something to keep in your mind as something that would add to your experience and make you a better professional if it's possible to achieve.
How have you been coping with your profession through this pandemic?
Well, certainly COVID has been difficult for all professions, and in medicine, it's required a lot of reconfiguration of how we see patients, how we perform surgeries, how we examine patients, and even to the point that, of course, during lockdown, for example, how would patients even get to us? We wouldn't want patients to sit at home with a serious condition and not even be able to make it to the hospital. So we had to reconfigure a lot of services and redesign a lot of things. But I think we've come out stronger for it. Certainly, there's a lot of good things that have come out the world over from COVID, which are going to be positive changes to medicine as a whole, and it will improve the patient experience in the years ahead. So it was a challenge, but I think we've come out stronger for it.
Amazing. Thank you so much. This was an amazing conversation. I really appreciate your time. Everybody watching, this was Dr. Salman Waqar, who is the consultant ophthalmic surgeon at Moorfields Eye Hospital here in Dubai. Thank you for watching. Thank you, Dr. Salman. And I look forward to seeing you all at our next Desk Careers Digital Spotlight.
Thank you very much, Maria. It's been a pleasure. Thank you.